This OG industry doctor has written more recs than you can even imagine. He's the founder of Medican and here to bring us a little bit of truth and prosperity for the people. Dr. Jean Talleyrand.
Thank you, Rico. Happy Friday, everyone. My headline today is out of The Guardian. Young people, pregnant women, drivers should avoid cannabis. Study by Andrew Gregory. Largest review of its kind says, while cannabis-based medicines may help some people, drug is detrimental for others. This study is published in the British Medical Journal. Canadian researchers out of the University of Ottawa performed the meta-analysis of 101 studies on the risks and benefits of cannabis use. 50 of the studies were observational and 51 were randomly controlled trials. They reviewed studies published between 2002 and 2022 and looked at the effect of different combinations of cannabis, cannabinoids, and cannabis-based medicines. The review of reviews concluded that cannabis was linked to poor mental health and cognition. Cannabis increased the risk of car crashes among drivers and led to poor outcome for babies when pregnant women used the drug. The authors said that cannabis should be avoided among young people while their brains are still developing. They argued that most mental illnesses are first identified during teenage years, and this was also a period when cognition is paramount for optimizing academic performance and learning. However, they also found that CBD was beneficial for epilepsy. Cannabis-based medicines reduced chronic pain and muscle spasms in people with MS. They also found that it helps nausea, vomiting, sleep, inflammatory bowel disease, and was found to be effective in palliative care. Some people misunderstand the purpose of reviews. They are used to develop theories that can be confirmed with more directed studies. The problem is that studies like these are misused to instill fear rather than their intended purpose. Using relative risk calculations to predict outcomes doesn't account for the individual state or circumstance. I have recommended cannabis oil to a 4-year-old with daily seizures and watched it improve her life. I have seen pregnant women with hyperemesis avert dehydration and potential miscarriage by using cannabis. I know some people who are less aggressive if they use cannabis before driving. Yet it's interesting that the author decides to warn young people, pregnant women, and drivers against using cannabis. There is a chance that someone in this circumstance needs cannabis, but avoids it because of this article. Population studies serve their purpose. As an individual, it's up to you and your physician to decide what's best for your circumstance. If you are young or pregnant, maybe cannabis is the best treatment for you. If you need to relax in a tense driving situation, maybe you ought to try cannabis. Discuss your use with a physician who understands the benefits and adverse effects of cannabis. Don't follow the headlines. Rather, know yourself. This is Dr. Jean Talleyrand with High at 9 News.